Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. This is another one of my new series Q&A with Dr. Z, where I answer your direct and your specific questions. So please don't stop them coming. If you have any specific questions for me, comment below underneath this video. As well, you can also email your specific questions. You can email them to my email directly. My email is in my biography on this channel. So please don't hesitate to ask your questions. Keep in mind, your questions have to be general enough. In the sense that if you're asking me, hey, Dr. Z, based on this and this and this, am I trans? I can't answer because I don't know your history. I haven't had a chance to work with you. It would not be ethical for me to give you any kind of diagnosis of gender dysphoria without really knowing your history. However, if your questions are general and broad and can be generalized, those are amazing and really the best questions to ask in the series. So that way I can elaborate and answer them for all of you. I've been really enjoying this Q&A because I love being put on the spot. I love not knowing what's coming at me. I actually randomly select 5 questions and put them aside and don't look at them until the video recording. So if you'll see me flustered, it's because I'm trying to formulate an answer for you. So I'm really enjoying them myself as well. Definitely keep those questions coming. So for today, I have again randomly selected, I can't speak to them, randomly selected 5 questions for you that we're going to go over. As always, I'm going to project the question on the screen so you can follow along. And I have also blocked out individuals' usernames for your privacy. If you ask this question, you probably will recognize your question right off the bat. So let's go through this. First question for today. The therapist I'm seeing is holding off on giving me a dysphoria diagnosis because I'm not dysphoric enough to be trans. I'm unable to change therapists because of external factors. How do I nudge them towards giving me the diagnosis? Well, initially, my first suggestion would be seek a second opinion, which doesn't sound like an option for you. For everybody else who watching who are in the same position, if you are able to seek a second opinion, definitely seek second opinion. Now, how can you nudge them towards giving you a diagnosis? Well, you kind of can't. They have to feel, I'll speak for myself because I don't know your provider. As a psychologist, I have to feel confident enough that a person has met the diagnostic criteria for a particular diagnosis for me to put it down on a paper. Now, your therapist is holding off because you say they're telling you you're not dysphoric enough to be trans. We know by now that dysphoria fluctuates and dysphoria varies for individuals. For some people, the dysphoria could be very mild to the point where they describe it as zero dysphoria because they have a hard time even recognizing they're having the discomfort. To individuals who have dysphoria to a very severe, to the point where they can't even look at themselves in a mirror because it is so painful for them. So we know the dysphoria varies in severity for everybody else. So when your provider says you're not dysphoric enough, I would encourage for you to inquire, what does it mean by that? What do they really mean by how they understand dysphoria, and why are they holding off? Why they're not, in other words, why they're not seeing in your presentation of your symptomology, in your presentation of your struggles, why are they not seeing that this is actually gender dysphoria? And if they're not seeing that, what else are they seeing that? So let me give you a personal example to clarify. Now, I work with a lot of individuals, and not everybody who comes to me has a clear presentation or clear case of gender dysphoria. Now, what is a clear case of gender dysphoria? I would say for us clinicians, clear case of gender dysphoria would be how we have experienced it up to this point in terms of seeing it as a pattern across the board. Oftentimes, what I look for when individuals come to me and they say, hey, I think I have gender dysphoria, but I'm not sure, and I think I'm trans, I'm not sure, and we're working on clarifying those things for that individual, I'm looking for variations of dysphoria. I'm looking for social dysphoria, I'm looking for obviously physical dysphoria, and I'm looking for variations of dysphoric factors in relationship specifically to their gender. Now, it is not uncommon, and I had worked with a number of individuals where they will come in and they feel no physical dysphoria, neutral about their secondary sex characteristics. They can describe it as, I feel fine. It doesn't give me any dysphoria at all. Zero social dysphoria. Also feel it's fine if people gender me as my assigned gender at birth. This is where I, as a provider, feel like I need to dig deeper, because if they're lacking any avenues of dysphoria, then what is going on there with their gender, right? So, and I wonder perhaps maybe this is what your provider is doing as well, but they have to explain to you what they're doing. In other words, I'm very clear with my clients to let them know that here's the thing. I'm not hearing any physical dysphoria. So you're saying you're fine with your secondary sex characteristics? Yes. I'm not hearing any social dysphoria. So when you gendered, as you gender assigned at birth, you're comfortable? Yes. Okay. So that doesn't sound like dysphoria to me. So what else is going on here? Why are you questioning your gender? Where is the gender issues coming from? And oftentimes, for some individuals, it's not even gender dysphoria related per se, but it, for example, some kind of combination of their maybe sexual life in terms of who they're attracted to starts getting really enmeshed with their fantasies to the point where they start wondering, could it be trans because I'm engaging in this type of sexual activity, or I'm being exposed to this type of sexual pornography or whatnot, or sexual imagery. In some other cases, people may feel like they're not comfortable with their gender expression, how they express themselves. So they're not comfortable with the gender roles that are imposed on them while being comfortable with their gender. Do you see the difference? Some people feel very uncomfortable with, for example, overly masculine gender roles imposed on them, and they feel like they have much more feminine and energy within themselves. But at the core, they feel very comfortable with their gender. That's a big difference. So we explore that. The point I'm trying to say is that I often make it very clear to my clients, here's why I don't see dysphoria. Here's why it doesn't sound like a typical case of gender dysphoria, if you will. It doesn't mean, I always tell this to my clients, it doesn't mean that down the road, it may not start presenting more like classic dysphoria. It doesn't mean that you're not trans. But in the meantime, instead of having you jump into any kind of medical or surgical interventions, which really are meant there to alleviate dysphoria, which you tell me you don't have, let's explore more about your gender role, your gender expression, and how all of those play and interplay with your sense of identity. So I would definitely encourage you to challenge your provider and just ask them, what does it mean by that? If they're not seeing that, what do they see? And having that open conversation hopefully will help you understand what they're thinking, because I would hesitate to say, hey, your provider is being gatekeeping or transphobic. I would really just, we're in a helping profession because we want to work with people. Therapists are often there because we genuinely want to better people's lives. So trust that your provider also wants to better your life, but dig deeper, ask them, like, what's your criteria? What criteria are you going off? Can we work on this together in exploring this? Because you're telling me that I don't really have diagnosis of gender dysphoria, but I feel like I do have gender dysphoria. So where's the disconnect happening? With my clients, there is no disconnect. They oftentimes seem to confuse what dysphoria really is when they're actually presenting to some other issues. And when I clarify and when I break it down to them, here's why I don't think it's gender dysphoria, things become clear for them. So talk to your provider, work with them, become a team, especially because you cannot change your provider. You don't want to become too resistant, and you don't want them to become too resistant. It's like unfortunately, it's a fine-tuned dance between the two of you. So I would really encourage for you to talk to them. Also keep in mind, I don't know where you're at and what country you are, but in the United States, for adults, you don't need to have a diagnosis of gender dysphoria to, for example, start a hormone regimen if that's something you want to do. There are a lot of informed consent clinics where a letter is not needed. So again, keep also that in mind. You do have that option. But if your provider says they don't think you have gender dysphoria, I would just talk more. Why do you think that? And if you don't think I have that, what do you think is happening here? So hopefully this helps clarify a little bit. But no, not everybody who comes in with gender issues has gender dysphoria. I have seen a number of people who don't have gender dysphoria and don't need to transition, but need to explore and integrate more in terms of their social, their gender roles, their gender expressions without really going through gender transition. So it's not that uncommon, but usually, not usually, always, I'm very, very clear. Here's why I don't think this is happening. And it's a collaborative process. I often ask my clients, how does it, does that sounds like it rings true for you? Because you know yourself better than provider, and my clients know themselves better than I know them. I may better distinguish and rule out some other things going on, other gender dysphoria, but ultimately you know yourself better. So second question, any suggestions on how to deal with the increasing transphobia in society? It's becoming very, very hard for me to deal with the fact that all of media is telling me that everyone will hate me. I'll lose everything and I'll regret transition. Thank you so much, Dr. C. So this is obviously a huge problem in the past several years, the increase of anti-trans, everything, anti-trans laws we're seeing being passed, anti-trans legislation, anti-trans you name it, from the content people produce on there to anything and everything under the sun. Here's what I gotta say. We live in a world where everybody has access to a platform. I have access to the platform. You have access to the platform. Everybody has access to the platform, and it is free. Instagram, Facebook, YouTube, TikTok, LinkedIn, they're all free social platforms, not to name all the other platforms. You have access to the platform. It's akin to having access to a megaphone that can reach millions of people for free. That means millions of people can hear what you have to say. So a lot of people feel like their opinion matters, their opinion is valuable, and they want to shout out into the microphone. As I always say, not every opinion matters. Not every opinion is valuable. Yes, people can say, this is how I feel, this is my opinion. Sure. Do you need to shout your opinion in the megaphone? No. Is your opinion valid? No. So keep that in mind, that the reason why there's so much anti-trans hatred is because there's so many people having verbal diarrhea on all of these platforms. I don't know how else to call it, but verbal diarrhea. It's an outpour of diarrhea that stinks. And the minute you walk into it, it lingers in your headspace. Having said that, you have to be selective. You live in a world, we all live in a world where now with social media and everything else, we're all exposed to different things. Even without social media, we're exposed to magazine tabloids, we're exposed to the way people drive, we're exposed to the way people talk to us who don't even know us outside our homes. We're exposed to a whole bunch of things that can and do often trigger us. I hate to say this, but this is true. While people can trigger us, those are still our triggers. And we have to work on that which triggers us and that bothers us. Triggers and things that trigger us are often a clue that something internally we need to work on ourselves too. For a lot of trans folks, when they get extremely triggered with the anti-trans content, there could be possibly that you're still struggling to accept yourself. You're still maybe carrying shame and guilt about your identity. I know this is a double-edged sword, because it's impossible not to get triggered when the world is telling you should not exist, when the world is telling you these horrible things. You're going to get triggered regardless, no matter what. But what I'm saying is that when you trigger is really deep to the point where it lingers for days and days and days, that's something for you to look at also internally. Limit the content you're exposed to. We all are triggered today. Everybody gets triggered. Everybody gets traumatized on a daily basis. We don't have control over it. I don't have control. Every time I read somebody else's, and I read everybody's comments on my channel, I don't have control over coming across somebody's comment that is nasty or hateful or mean or just really abusive toward me and toward trans people I work with. You know what I have control over? I have control over my emotions. I have control over what I do about that, okay? And while there's certain things the control is going to be limited to, you can, and we all can, limit our exposure to social media. exposure to news, which outlets you listen to. Are you reading the type of news that are more objective and more mindful versus more hateful? Are you constantly exposing yourself to media that is just hateful, or are you limiting that? Same thing with the positive social influences. Are you also changing the negative social media influences for individuals who are very supportive, for individuals who are very uplifting in regards to trans individuals, for individuals who are on social media making amazing positive content, sharing with you, giving you information, trying to better your life in a way where it is also objective and mindful? That's what I would recommend, because we can't change the world. None of us will change the world, nor can we change society. What we can do is we can change ourselves. We can change how much control, how much exposure we have to the things. And we can also change how often we watch content, which content we watch. I'm on a lot of social platforms, and I limit myself to the comment section because I want to interact with all of you. And that's it. Now, I get a lot of hateful, nasty shit going on all the time. I don't respond to those comments. I just ignore them. And the more I ignore, the easier things get. The less I'm able to get them to my head. But even me, it gets to me too. We're all humans. It's hard not to. But work on those things. Work on limiting. Surround yourself with positive things. Surround yourself with positive voices. Be discerning about whose content you consume. There's a lot of people who create content. Now, you can sit all day and you can listen to anti-trans content and be fuming inside and interject that content and hate yourself more, or you can consume positive content that helps you feel better about yourself. So be selective, but it is going to be hard. I know that you're starting to feel like you're going to lose everything and you're going to regret transition, but that's just really interjecting. When you interject so much of that content, you start thinking that it's true, and it's not true. People, anti-trans people, they want you to believe all that shit is true. So, and you know that the content is toxic because it is often judgmental, it's not critical thinking, it's not objective, it's not somebody objectively saying, hey, I don't understand. Can you explain to me more? What exactly is gender dysphoria? It is somebody who's just really hateful, and that's how you know that it's really toxic, and you just really want to avoid it. So hopefully this helps. This is, by the way, for everybody. Limit yourself to all the social media. Remember, everybody has a megaphone and opinion. Doesn't mean their opinion is right or good. The same goes for my opinion, by the way, too. I try to make my opinions and my thought processes based on my experiences so that they're grounded at least in some kind of consistency in terms of my observations. And I try to make them as objective as possible without cheerleading you into transition and without also gatekeeping you from it, but helping you have a foundation where you can ask those questions yourself and where you can figure out for yourself what you need to do. That's my goal. My goal is to help you sort things out for yourself instead of really telling you, hey, go do A, B, C, D. So next question. Good segment idea. I'd love to see more of these videos in the future. As long as you guys have questions, I have answers for you. My question, my mom is wanting to support me transitioning in some way, but she keeps trying to figure out the cause of me being trans and pushing me to do other things to solve my issues besides transition. My dad has pretty much been ignoring my explanations about being trans entirely. There's technically nothing stopping me from transitioning, but my doctor suggested that I should have a support network before transitioning. At what point should I give up on trying to make them understand and just move on with my transition with or without their approval? I still live at home and I'm also unemployed right now. So let's address your mom first. It is not uncommon for parents, for either both or one parent. I'm assuming you're adult, by the way, because my content is only for adults. So keep in mind, this is only going to be relevant to you if you're adult, because all of my expertise comes from working with adults. It is very common for parents to feel a need to figure out the cause, like the root cause. Give me the blood work, give me the test, give me some kind of science, give me some kind of chart that tells me my kid really has trans identity. We don't live in that world. There's many causes that are interplay together in order for individual to struggle with gender dysphoria. There's not one cause. For many people, it's a multi layered type of experience happening that leads to experiencing any kind of dissonance or incongruency with their gender assigned at birth. So your mom is going to still need that, and that's okay. And she just may have to accept the fact that there's never going to be the cause. I'm sorry to hear that your dad is being not really open to any explanations you bring at all. Sounds like both of your parents are somewhat semi-rigid. Now, you're saying that there's technically nothing stopping you from transitioning. So I'm assuming that's because you're adult and you can consent to your own services, except sounds like the only thing that's stopping you perhaps is that you live with your parents. Sounds like you're financially dependent on them because you are employed at the time. And while you sounds like can still move forward with transition, it will be difficult for you because they're resistant to what you're doing. Here's the thing. Your doctor suggested you should have support network before transitioning. That is true. Support network is helpful, it's important, it's crucial. But you don't necessarily need to have full support of your parents in order to move forward. Support can come from many individuals. It can come from your peers. It can come from other caregivers in your life. It can come from people on internet. It can come from support groups. It can come from your local LGBTQ center. So don't feel that you necessarily need just support of your parents, because sounds like, given the resistance, it may take a while, if ever, for them fully to feel like they understand your gender identity. What I do recommend is that if you completely don't have any support, start forming your support system. If also living with your parents at home while considering moving forward with your transition is challenging for you because it's going to create tension between you and your parents, I would recommend, can you start working on moving out of your home? Can you start working on getting an employment? Can you start working on all of those things? In other words, start putting those things in order, because ultimately it's just going to make things easier for you. Transition can be challenging. It is absolutely, without a doubt, can be very difficult for many individuals. Not having support and living under the roof of people who are financially helping you and who are resistant to what you're doing with your life can also create its own challenges and frictions and tensions that may be very difficult to deal with. So I would recommend, if you're really lacking support, start building support system around you. Like I said, local LGBTQ centers, online groups, your friends, and start looking for employment. If nothing holding you from transition is still costs money. Even getting hormones, even making those doctor appointments, with or without insurance, still going to cost money. So start putting those things in a row. You are making very big adult decisions about your gender, which is important. You also need to start making big adulting decisions about your life. We'll all have to evolve into our adulthood and start adulting, which we don't always want to, but it's important for us. Having an employment will be important for you. It will be so good for your self-esteem, for your confidence. Maybe at your employment, you'll be able to also express your gender identity and get validation and support and feedback and affirmation. And that's going to make you feel even more confident. So definitely start putting those things in order so you can have those building blocks to move forward. But I would not necessarily wait for your parents to come to an agreement, because as adult, you have to start thinking about your life. And if you, sounds like you're sure you're trans and you have gender dysphoria, and if it's debilitating you, if it's interfering with your life, you have an option to do something about it, absolutely. So hopefully this helps. I know it can be really challenging with parents not really giving support, but it's hard. Parents can be difficult because they are of other generations. They have their own beliefs, values, and they oftentimes cling to this idea, which means that we know you better than you know yourself, which is not true. And they're going to hold on to that. It sounds like you also already done everything in order to educate them. And, sometimes, like I always say, the proof is in the pudding. When people start living their authentic selves and they're happy and healthy and parents see that, that is a better conviction that you made the right move forward in your life than any kind of studies you can bring to your parents. So hopefully this helps. Next question, Dr. Z, do non-binary people have to microdose, which is taking lower dose of hormones, on hormone for the entire life to maintain their appearance, or need to do only for some months or years, and then they can stop it? They have to take it for their entire life. Would it add up and make drastic changes that you don't like? This is a great question. First of all, it's a great question to a medical provider. I'm not a medical provider, I'm a psychologist. So if you are thinking about microdosing, either feminizing or masculinizing hormones, talk to your provider. Very, very important. Always talk to medical doctors when it comes to medical services. But I can answer the question in general terms based on my experience working with clients who have microdosed in the past and how it played out for them. So it also depends. What are you going to microdose? Microdosing feminizing hormones is different than microdosing testosterone, masculinizing hormones. So it's also going to depend which one you're actually choosing to microdose. For non-binary individuals, it always comes down to, first and foremost, what are your goals for microdosing hormones? What are you trying to achieve? Is it something that you're trying to achieve that can be achieved without hormones? If yes, then great. But what are your ultimate goals? A lot of times people, for non-binary folks, when they want to microdose, they want very subtle changes, especially on masculinizing hormones. They want, for example, deepening of the voice, but they don't really want facial hair. Or they want a little bit of this and a little bit of that, and the same with feminizing. Microdosing is not as easy as it sounds. It's not like cherry picking things. You oftentimes don't even know what you're going to end up with, even if you're microdosing low dosages, because everybody is different and everybody will metabolize the hormone differently. For that reason, you may walk in the office and say, hey, I just want this and this and this. Can we start microdosing until I get this effect and stop? And while you may get those things, you may also get a lot of other things you did not want. So for non-binary folks, it's a little bit tricky because not all of the masculinizing or feminizing things you're going to want. A lot of non-binary people are a little bit more selective. It's easier when a person is, really identifies as trans femme or trans masculine, and they want all the masculine or all the feminine effects with the hormones. It becomes easier in that regard. But with microdosing, it's tricky. So what are your goals? Discuss your goals with the doctor. Be very clear about your goals and be very clear about what you can get and what you're also going to get that you're not going to want. Are you okay with those things? For example, microdosing testosterone, even though you're taking a low dose, just can still produce facial hair. For people who don't want facial hair, if you're going to start having facial hair, what are you going to do about it? Are you in a financial position to then, after you get the other effects you want of microdosing, say voice deepening, but you want a smooth face, are you in a financial position to go through electrolysis or laser hair removal to remove that hair? Prepare yourself. Ask yourself all of those questions. Now, do you have to microdose for the rest of your life, or can you stop? It again depends on the changes you want. If you just want deepening of your voice, once your voice deepens, you have a deep voice permanently. Facial hair, once your follicle grows, it really also depends on how fast your facial grows, whether you want to achieve the full facial growth, because for a lot of individuals, microdosing or even full dose of testosterone, sometimes it can grow in patches, which can be very challenging if you want a full facial growth. So again, really depends what your goals, what you want to achieve, how your body metabolizes the hormone. And depending on all of those things, the doctor will be able to tell you which, for that particular end result, whether you want to microdose for X amount of time or for a long period of time. But a really, really good question for your medical doctor. You have to work with your medical team in order to figure things out for yourself. But keep in mind, it's not a cherry picking method. A lot of people think, oh, I'm just going to microdose and slightly feminize myself or slightly masculinize myself. Well, sure. What does it mean for you? What does slightly masculinizing mean for you? In this case, what specifically are you looking to get out of microdosing things. So you have to be very, very specific what you want. And you have to also know that with those specifics, you may not only either get those things or not get those things, but you may end up getting a lot of other things you don't want. So it's challenging. I'm not gonna lie, there's no one particular method for, oh, you just want to microdose for this. Oh, we know exactly how to give it to you so you can just get those changes. And that would be great if that existed, but it doesn't. So just be more aware and educated about all the things that they can and cannot do for you. But great question, because a lot of non-binary folks always wonder about microdosing and whether they can get those changes, how long they have to be on hormones, and it's really depends on a lot of factors. So talk to your medical doctor. The last question for today. Hello, Dr. Z. Enjoy you and your video. Thank you. My question is, how do I let my wife know I feel feminine? She caught me once in panties and asked if I was gay. I don't think I am, but I could be attracted to trans or fluid person. If after 30 years something happened to our marriage, I would like to be able to, without hormones, be as feminine as I want, as I am 65-ish, and you either 65 or you're not 65-ish, and don't want not to be able to be more feminine. What or how to I broach the subject? Thanks, Pam. Okay, so how do you let your wife know you're feminine? You feel feminine. So she already caught you once, right? She's wondering if you're gay. You don't think that you're gay. After 30 years of something happening to our marriage, okay, meaning you have invested 30 years in your marriage and you don't want to lose that investment, you don't want to lose that marriage. I'm assuming that's what you mean by that. You would like to be without hormones, but be as feminine as you want. So here's the thing, Pam. How do you let your wife know? You've been together 30 years. She already caught you feminizing. She already knows that you have a tendency or there's part of you that is inclined towards feminine end of spectrum. Hence, she wondered if you might be gay. The best way to talk to partners is to just really talk to partners. And there's really no best time except now. Really, especially you're 65, you really want to be more feminine in your gender expression. Not interested on hormones, you don't want hormones, but you want to be as feminine as possible, maybe in your intimate life. Maybe you want to be as feminine as possible in the privacy of your home, whatever that may mean for you. Harmless and probably will benefit you tremendously in regards to your gender identity. So you sit down with your partner and you tell them, hey, I have been struggling with gender issues and you let them know for how long. They have been really kind of bugging at me. Remember the time when you caught me feminizing? I feminized in the past or currently, whatever the situation is, because it helps me get more in touch with who I really am. I'm not, as you say, you're not gay, which I can understand your wife's question, because then she's wondering, are you attracted to me? Are you attracted to women at all? So you can help her understand your sexuality. And you can also tell her that I am at my age or whatever, for whatever reasons, transition is not for me. I don't want to go on hormones, but I do want to start expressing my gender more feminine on a more daily basis, because it really helps me get in touch with who I am, and it also helps me to relieve my dysphoria. And that's how you start your conversation. She will ask you a lot of questions. What does it mean? How long has it been going on? Does it mean this and that? And you just take each question and you just try to answer the best you can. What does it mean you want to be more feminine? Okay, well, maybe for you it means occasionally, can I go to sleep next to you wearing feminine panties? Maybe for you it means, on weekends in privacy of our home, I want to wear this beautiful little kimono I have. Whatever that is means for you. Maybe for you it means sometimes I would like to be to do my makeup and feminize and be at home like that, or maybe even not at home like that. You have to break it down for her. You have to explain to her what you want to do, and if also have her kind of discuss with you what makes her feel comfortable, what makes her feel uncomfortable. Now, of course, partners can be very resistant. Some people will say, well, why should I even listen to what makes her comfortable? I've been struggling with this. The reality is that you don't exist in a vacuum. And it sounds like for you specifically, you want to preserve your marriage. You said you've been together 30 years. You want to stay with this woman. If you want to stay with this woman, then you have to work also not only within your comfort zone, but within her comfort zone. And the best way to do that is to help her understand why you're doing things, how they're helping you, how dysphoria is really painful for you, how dysphoria is affecting you. The more partners understand, the more they're going to be open to that. But the best way to talk to your partners is just to sit down and to talk to them, is just to start having that conversation, to just start really telling them how you feel and answering all their questions. They can, of course, be freaked out by what that means. And with each question they have for you, you will just have an answer back and you have the discussion, you have the dialogue. And hopefully you reach some kind of agreement, some kind of comfort. I had couples I worked with where there are a new age group where a partner is feminine and they present feminine in the privacy of their home all of the time without hormones or any other medical interventions. And the partner is, usually what people tell me, the partners at least, they say that, you know what, this is my companion. I've been with this person for 30 or X amount of years, and I love and I care about this person. And you know what, they have this feminine side to them, and if they want to present feminine, I was like, okay, that's fine. I'm glad to meet that side of them. So you never know how chips are going to fall, but you want to be honest with your partner, and if you're ready to be honest with your partner, the best way is just to sit down and tell them. So hopefully this is helpful to you, Pam. Hopefully you'll be able to do that, and hopefully things between you and your wife are going to be good. Comment below, let me know if you have any of the questions. A lot of times somebody will ask a question and it's exactly the type of question somebody else had in their mind. And this video can elaborate a lot of the things or clarify some of the things. So comment below, let me know. As always, feel free to ask me those direct questions you have. I'll keep making the series, releasing the videos on Monday, as long as I have questions. So far, I still have some more questions to answer. So comment below, let me know. Love hearing from all of you, and I hope all of you have a great day. Bye.